This patient was referred to me for endodontic retreatment of tooth number 3. According to the patient, this root canal was done a few years ago. Recently, tooth started to bother her, and she went and saw her dentist and was referred to us for endodontic retreatment of this tooth. Tooth had a crown on it, was tender to percussion and palpation. What do we do next? We do probing. But let me just go over the PA with you here. You can see the crown here, prefab metal post. You can see previous root canal. Look at this J-shaped radiolucency, right? All right. So let's go ahead and probe the tooth.
All right, so as we take these measurements, walk the probe, and right about here, as you can see, the probe sinks in, and I'm at 9, 10. I can go further, go to maybe even 11 or 12, but I'm not going to. There's no need. We already have our answer here, and you can see how much of the probe was in.
All right, so you saw the probing, and you know what I'm going to say. Vertical root fracture, unfortunately, with this tooth. So if we hadn't probed this tooth and jumped straight to retreatment, of course, we would have misdiagnosed, and the patient would have suffered in our chair, and the patient's pocket would have suffered. So that's why it's very important to have proper diagnosis, to diagnose properly, so that way the patient doesn't suffer in the chair and also, of course, financially. In this case, we were able to diagnose properly. This tooth is vertical root fracture and unfortunately needs to be extracted. Take a look at this case now. This patient was referred to me for endodontic retreatment of tooth number 30. The root canal was done a few years ago, according to the patient, by her previous dentist. So take a look here. Crown, prefab metal post. That's one broken file, and that's another broken file. So this dentist who did the root canal broke 2 files in this poor patient's tooth, and you can see a periapical radiolucency here and some root resorption, apical root resorption also. You can see the broken file here, periapical radiolucency, another broken file here. All right, so you also see, and that again, that's why it's important to be able to read radiographs. Take a look here. Remember the trick I taught you. Look at this prefab metal post and look at the level of bone loss here. Distal bone destruction here. Look at the level of mesial bone, how nice and healthy it is. If you extrapolate from the mesial of number 29, you go to distal of number 29, and you need to extrapolate, and this is where the bone level should be. Look at the distal of tooth number 31, but the bone level is here, and it's pretty much almost perfectly corresponds to the end of the post here. So let's go ahead and probe this area here.
Yeah, as I walk the probe, everything is okay. There's some gingival recession here, and that's the root showing. Root of the tooth showing, mesiobuccal root. And then when I go back here, that's where my probing goes to. Yeah, let me go to the side here so you can. Yeah, right here, that's where the pocket is deep, and I'm going to 6-7 millimeters, and you can see there's bleeding on probing. That is deep. That's 6 millimeters.
So you saw the probing. So unfortunately, this is what we call a split tooth. This tooth overall, even if it wasn't split, would have had a very guarded to poor prognosis anyways. I would have very likely been able to remove this piece, this broken file. But right here, this broken file, I would not have been able to remove it. I would have probably tried to bypass it, but you can see the way it's broken. I would have probably tried to bypass it, but the risk would have been, and again, I went over this with the patient, the risk would have been in the process of trying to bypass this broken piece, it would have been possible to push it out the root and cause further complications. So this tooth, I think, best would be extracted.